See, what's actually fueling this whole global movement? Well, you can think of it as a bunch of push and pull factors. The push is stuff like crazy high costs and endless waiting lists in people's home countries. And the pull? That's things like cheaper flights, easier visas, and of course, the internet, which lets you research a hospital halfway around the world from your couch.
But here is a twist that shows you just how complicated this all is. China isn't just a destination. It's also a huge source of medical tourists. Just look at the number of Chinese patients who went to South Korea for care. It more than quadrupled in just 2 years. It shows this isn't a simple one-way street of people flying from west to east. It's a super dynamic global market where a country can be both a seller and a buyer of healthcare.
Of course, an industry this big and booming comes with some major risks. And these are not small footnotes. There's a real lack of solid data on how patients actually do after treatment. What if something goes wrong? Trying to navigate malpractice law in another country is a legal nightmare. Then you have huge questions about your care once you get back home, and even public health risks like spreading drug-resistant germs. These are central challenges for any patient to think about.
So far, we've pretty much been looking at this from an outsider's point of view, the tourist. Now we're gonna pivot. We have to look at the view from within because it adds a layer of context that is absolutely essential to getting the full picture. So let's just ask the question straight up. What is the healthcare reality for the 1.4 billion people who actually live in China? Because the system they navigate every day is not the one that's advertised to medical tourists.
And this right here is a really sobering statistic. While a foreigner might fly in for top-of-the-line cancer treatment, the overall 5-year cancer survival rate for patients inside China is about 30%. In the US and Europe, that number is more like 60 to 70%. Now, that's not about the skill of any one doctor. It points to bigger systemic issues, like people often getting diagnosed at much later stages.
Faced with those kinds of challenges, a really powerful movement of what you might call patient self-advocacy has popped up. This quote from a 15-year liver cancer survivor says it all. He basically says you have to take responsibility for yourself, you have to understand your own illness. It's all about empowerment, about the patient becoming an active partner in their own recovery. And this isn't happening in isolation. Patients have created these community self-rescue groups, like the famous Beijing Anti-Cancer Park.